Hello, pharma friends. Welcome to Pharma Syndrome YouTube channel. You know, this channel main motto and aim is to give information in easy way to remember as well as to understand. And in this regard, in this video, I'm discuss regarding the drugs for tuberculosis as well as leprosy with tricks and mnemonics. You can feel crazy and you can remember easily. And for more interesting information, subscribe to our channel. Let's enter into the session that is tuberculosis as well as leprosy. So as you know, both tuberculosis and leprosy are caused by the mycobacterium species. So mycobacterium nothing but one of the bacteria which is excess, nothing but which contain excess source of the mycolic acid is a lipid substance. And even the mycobacterium regarding microbiology, it gone through the staining, acid fast staining, not a similar to the gram positive or gram negative. And you know, tuberculosis is a disease, a potentially serious infectious disease, mainly affect your lungs. The bacteria that cause tuberculosis are spread from one person to another person through tiny droplets released into the air via cough as well as sneeze. So the transmission through the air. And nothing but the tuberculosis is mainly affect the lungs. It is caused by the Mycobacterium tuberculosis. And the drugs for tuberculosis are first line drugs. These are the first line drugs giving first preference. The trick is price. That is, P means pyrazinamide, R means rifampicin, I means isoniazid, S means streptomycin, E means ethambutol. So these are the first line drugs. You can easily remember by using trick price. Next is the second line drugs. And this preference after the first line drugs. The mnemonic is, nothing but trick is the tech cap, means T, thiaacetazone, E, ethionamide, K, kanamycin, C, capreomycin, again cycloserine, and A, amikacin, and P is the para-amino salicylic acid. These are the second line of drugs for the treatment of tuberculosis. So as you all know, tuberculosis is caused by the Mycobacterium tuberculosis, and it is mainly affect the lungs. Tuberculosis is a disease mainly affect the lungs, and the transmission through the air from one person to another person in the form of cough or sneeze. And the miscellaneous category. So apart from the first line and second line drugs, the miscellaneous category drugs for the treatment of tuberculosis are fluoroquinolones like ciprofloxacin, ofloxacin, moxifloxacin, levofloxacin. So fluoroquinolones are nothing but these are synthetic antimicrobial compounds effectively for the treatment of bacterial infections. The fluoroquinolones are acts by the inhibiting DNA synthesis in both gram positive as well as gram negative bacteria. And other category regarding miscellaneous category is macrolides. So macrolides also one of the antibiotics comes under the category of protein synthesis inhibitor, inhibit the protein synthesis in the bacteria and decreases bacterial infection. And examples like azithromycin as well as clarithromycin. So this is simply TB as well as drugs for the treatment of tuberculosis. And another one is leprosy. So leprosy also called as Hansen's disease, and it is an infection caused by the slow growing bacterium called Mycobacterium leprae. So same, thus Mycobacterium tuberculosis for tuberculosis and Mycobacterium leprae for the leprosy. And it mainly affect the nerves, skin, eyes, lining of the nose, and nasal mucosa also. Okay, and based on its appearance of the skin, it is two types: bacillary leprosy, which is a non-infectious in nature, with 2 to 5 skin lesions. So lesions nothing but wounds on the skin. And multi-bacillary leprosy, which is infectious in nature, it having more than 6 skin lesions. So based on these two categories, the leprosy will be categorized as a bacillary leprosy as well as multi-bacillary leprosy. And there are very few drugs for the treatment of leprosy. And that also I mentioned with a crazy trick, that is Mr. Code. So M means moxifloxacin, which is a fluoroquinolone, and minocycline is a tetracycline, and rifampicin generally for the tuberculosis, and it is also for the treatment of leprosy. And clofazimine. Clofazimine is specifically for the leprosy treatment. And ofloxacin, again fluoroquinolone. And dapsone also a specific drug for the treatment of leprosy. And ethionamide. And ethionamide also tuberculosis drug. Nothing but drug for tuberculosis. Means in the leprosy treatment, the specific drugs for leprosy are clofazimine as well as dapsone only. And remaining all drugs are from the different categories. Okay. So this is simply about drugs for tuberculosis and leprosy. For more like information, so subscribe to our channel Pharma Syndrome and share, like, comment your views on our channel. All the best. We will connect in the next video.